We're joined from Palestine by the director of the Medical Relief Association in the Gaza Strip, Bassam Zaqout. Thank you for joining us here on Q News. Sir, firstly, let's start off by asking what can you tell us about the food shortages and the obstruction of the distribution of aid in general? We know that this has been a tactic used by the Israeli army.
I believe that we are in the peak of the crisis, especially from the last 3 days after attacking the World Central Kitchen staff, where they stopped their operation. The daily operation, they were providing daily meal for at least 300,000 of the population in that day. Also, the announcement from the UNRWA that they will not use the Karam Abu Salim crossing for their truckloads from the recurrent or frequent looting, and Israeli policy not to providing safe roads for the humanitarian assistance and restrictions toward Gaza, other cause for the problem. However, from the information or from the report that we know that the famine threshold may have already been crossed, or else will be in the near future, especially in the northern part of Gaza. At least, as far as I know, 90% of the population are projecting to face high level of acute food insecurity, where 50% of them now facing the emergency levels and 15% at catastrophic levels. This is what describing the situation of food insecurity. There is at least 91% of the children are not meeting their daily requirement from the food that they are receiving or they can access, and as well as women or other vulnerable groups of the population, as elderly, all people who have cancer or other diseases that require the special food.
Sir, you talked about the idea that organizations like the World Central Kitchen, in addition to UNRWA, they were providing meals or providing food aid in general. So what are the Israeli restrictions on the entry of aid into northern Gaza, and how is this affecting the humanitarian situation? You spoke a little bit about the idea of malnutrition and all of that, but are we seeing some sort of improvement, for instance, or is it getting better or worse?
No, I said that we are in the peak of crisis and the situation is very worse. It's very worse. A lot of people not don't have now access to the real food, and if they have some saving from the previous assistance that they have received, so they are close to the end of using this store that they have, and there is no immediate solutions for the population to improve their access to food, unless there is the World Central Kitchen or the UNRWA have returned to their full load of assistance as they used to at the beginning of this crisis.
Sir, you spoke a bit about the idea of malnutrition, but there are also other challenges that face the Palestinians in Gaza. What challenges will the displaced face with winter approaching and the temperatures dropping? What possible solutions could there exist to alleviate the suffering of the people, especially those who have been displaced?
As you know that most of people here need winterization support. At, at least as far as I know, 1.5 million of the population, they don't have safe shelters, and they're in need for emergency shelters as soon as possible, because we are very close to the peak of the winter, and where there's the wind and the rain, and that people don't have something to protect themselves. Most of people, they don't have even the warmer clothes for their children, especially those who were displaced at the beginning from war in the humanitarian zone, because there is no clothes available that they can buy. Uh, I think also there is around maybe 20% of the population are living in the flood-prone areas, so they are might be affected from the heavy rain and from the flood that can maybe destroy their shelters if they have it. And all this, there is no, I think, immediate solution for that, because when we are talking about a huge number of the population in need for winterization support, and within the current Israeli policy of restricting the aids,
Yes.
this cannot come and cover the needs in the period that the people required. And within 1 month, I think this you cannot have enough
So, sir, the final question here for you is
to cover the needs of 1.5 million
yes.
from winterization.
Yes, well, my final question here for you, sir, is addressing the Israeli airstrikes themselves. Obviously, this is compounding the situation when it comes to the humanitarian situation on the ground, especially since, even medical aid is not allowed in. How has this, drained the healthcare system, for instance, or, central kitchens that provide meals for people?
Sorry, I'm not getting very well the question.
Yeah, I'm asking about how the airstrikes, the Israeli airstrikes, are compounding the humanitarian situation right now in the Gaza Strip, especially in the north.
The airstrikes.
Yes. How are they affecting, distribution of aid?
هو يعني especially the last attack in the World Central Kitchen has put all the humanitarian actors in a position to ask themselves, they are safe to continue their working or not? And this is causing a problem of their trying to restrict their movement, at least at this period, and to restrict their assistance. At least there is some clearance in the situation. If this attack to the World Central Kitchen was in purpose, that in purpose for something that Israel, as they said, or as we understand, it was in purpose to restrict the aid or to increase the suffering of the population and let the humanitarian aid to have some limitation in their work, I think, to cause more suffering for the population. This is our understanding. Also, as you know, there is a continuation of Israeli aggression through different means, through sometimes it's attacks, and just yesterday they announced a new area in the Khan Yunis, inside the humanitarian area. They asked people to leave this area as soon as possible, and they might be attacked this area at the new ground operation.
Okay. Unfortunately, sir, we're sort of out of time for this segment, but I'm sure we're going to get back to you. That was the director of the Medical Relief Association in the Gaza Strip, Bassam Zaqout. Thank you so much for your insights, and thank you for joining us.